we are looking at yet another outbreak. Last time when we saw something like this coming up, we did not expect it to turn into a pandemic. That time it was coronavirus. Now it is hantavirus. When we are talking about this virus, as of now, WHO says it is not going to be a pandemic-like situation. But the worrisome part is this is something very similar to what WHO said back then as well. So what exactly is hantavirus, how deadly it is, and why it has gained the global attention? Hello everyone, welcome to Vajiram and Ravi's Flash News. My name is Shubhangi Singh, and in today's session we are going to talk about hantavirus. What does the situation look like now? What are the areas of concern and how we can work towards probably preventing it? So as of now, to understand what exactly is unfolding, first we have to understand that how it came to the disclosure. So we have to go back to this particular Dutch expedition cruise ship, that is MV Hondius. Now this was moving from Argentina, then South Atlantic and towards the Canary Islands. Now it had 147 passengers on board, and by the time outbreak was detected, 34 passengers had already offboarded. Later, 8 infections were detected. Unfortunately, 3 deaths have happened, and as of now, multiple infections have been detected across countries. And that is why the most recent update in front of us is the fact that the French national, that means on the cruise ship who were people present from France, they have returned from the cruise ship and they are showing the symptoms of hantavirus. So in this situation, the first thing that we need to break down here is to understand that what kind of zoonotic disease is this, because when we were looking at COVID, this was again that brought light to the scope, the deadly aspect of zoonotic diseases. And this also brings our attention towards how WHO is monitoring this whole situation, how and what level of attention and prevention it requires as of now. So before moving to that, let us break this down. First, what is hantavirus? Hantavirus is basically a group of viruses, and these viruses are spread by rodents. So it can be carried by rats, it can be carried by mice or wild rodents which are present across. Now when we are talking about these set of viruses, they can lead to particular diseases such as HPS, that is hantavirus pulmonary syndrome. That means you will have a severe lung infection and there will be extreme respiratory distress. The other one here is HFRS, which is hemorrhagic fever with renal syndrome. That means kidney damage will be present. The blood vessel complications can also be seen. Apart from that, when we are talking hantavirus, we have to understand that this is a zoonotic disease. That means it spreads from animals and it can infect humans. But the question is how? So humans can inhale the virus particles, and that comes from rodent, be it their urine, saliva, droppings. If the presence of given things is there and humans are around, the possibility of inhaling those particles is higher. As of now, the 3 deaths that have occurred, they are carrying Andes strain. Andes mountain. The strain is coming from there, and it is showing, the name has been given from there, that human to human transmission is possible. As of now, what we knew, that the transmission only happens from rodents and the particles can be inhaled from urine, saliva or droppings. But the new strain which have caused the death is showing that human to human communicability is possible. That means if somebody has caught hantavirus, then they can pass it on to another human, and that can happen with close contact. So that means the transmission, the spread which was limited in this context, that means the spread will only happen if these things are present, if these things are duly cleaned up, or if they are not, the spread is not possible. But if one person is infected from this, the spread increases immensely if it goes by human to human transmission. And this is where the problem is increasing multifolds for us. Now the spread can be detected in form of symptoms such as early symptoms, be it fever, muscle ache, fatigue, which can be usually confused with regular viral as well. And then we have severe symptoms where we can find chest stiffness, pneumonia, fluid in lungs, and this is where the mortality risk comes in, because the severe respiratory forms that we are talking about here, they can become the reason for death if there is not timely medical intervention. And this is the point where we need to understand that why the global focus has all of a sudden shifted, the global concern has arisen, because as of now, the spread is not across a nation, it has happened across the globe. When we are talking about the passengers, they have traveled to multiple countries before the diagnosis. That means the spread that we were talking about, the human to human transmission, even though it is limited, that is possible. And this case also highlights the fact that the zoonotic threat is real. The animal to human spillover of diseases is becoming more prevalent, is occurring more frequently, and that is why it is time that we focus on public health preparedness. We focus on early surveillance, rapid testing so as to get the diagnosis done in time, and a situation like this calls for international coordination before it turns into a pandemic from an outbreak, because this is exactly what we were seeing in 2020, the start of the year, and WHO said that the public health risk remains low, the spread of this into a pandemic is limited, and there's nothing to worry. So as of now, WHO is saying something very similar, but it is very important for us to focus on the measures. On this note, I would like to ask you, what are the measures at the policy level that can be taken to address zoonotic disease threat that is increasing day by day? Let me know in the comment section. That was all from my side. Thank you so much.